All right. Let's see if we can do this. We're back. Round two. I've only ever done this live thing on TikTok one other time. And we'll just kind of see how it goes here. I'm just trying to see if it's possible to, just trying to look and see if it's possible to, like, I have an iPad here, and it would be nice if people's comments and whatnot could show up on a different screen, but I don't know. It doesn't look like it's easily accessible right off the bat. So yeah, I hope everyone's having a nice 4th of July here. It is actually pretty warm. I'm in Wisconsin, and it's actually pretty warm over here. So what's the temperature? It's like 84 degrees, but it's nice out. I mean, it's sunny enough out here. I had posted a video just a few minutes ago about how to you know, if you think that you have ADHD, how do you get evaluated? What does that look like? What should the steps be? And so I just posted a video just a second ago on that, and just before that, probably what most people would be coming into the room for is that video about the ICNU stuff. How you can tell if somebody's you know, what kinds of things motivate a person with ADHD. And so it's different than maybe the general population. So, but I hope everyone's having a wonderful day. I think that people usually like grill out on the 4th of July. I think that's what people do. People usually do that. I had anyways, starting to go off on a tangent there. But this is just the second time I've done a live video like this before, and so I took some feedback from the last one, and I've set the camera down on like on a tripod here, and so it's not kind of moving all over the place there. Hey, how you doing there, Mac? Are there specific tests for ADHD? Yeah, there are, absolutely. There are ones that we as psychologists use pretty frequently. I like to, I mean, if I have the ability to, I like to give a real full evaluation. So I like to test intelligence. And then also I like to test what's called executive functioning. So that's the part of the brain that's affected mostly by ADHD. And I point to my head like this here because it's the part of the brain that's affected by ADHD is right behind the forehead. And so that so we test for executive functioning. So and then I usually try to do a psychological eval. So I give like a personality test or something like that. Are anxiety and ADHD symptoms the same sometimes? I'm trying to figure it all out. If I have ADHD as well, totally, I hear you. Yeah, there's absolutely a major overlap between ADHD and anxiety. Because like, for example, ADHD, there can be some tension and inner restlessness. That's pretty common in both anxiety and ADHD. Also, with ADHD, there can be this tendency to kind of get stuck and what they call perseverate. So you kind of ruminate about things, and your mind is busy. You're thinking about things that went on or things that have to happen and stuff like that. And that can be, again, pretty typical with anxiety and ADHD alike. How can anxiety can be identified? Well, so I mean, ADHD and anxiety are also very, very different. I mean, basically, is the anxiety debilitating in your life? That's the question. In other words, does it affect your life in a significant way? And if the person is kind of saying, yeah, Yeah, it is, X Digital. Are you my daddy cam? Maybe. Do you know me? Do we know each other? Yeah, so but they do co-occur together. So a person can experience significant anxiety and then also, significant symptoms of ADHD for sure. Are there levels of severity with ADHD? Yeah. I would say, kind of this mild, moderate to severe is probably the range. The more pieces of criteria you meet for ADHD, the higher severity it is, for sure. And I've never been to a psych. What kind of test do I ask for? A complete review of myself? That's a good question. You can let them know, like, hey, I'm interested in wondering if I figured out if I have ADHD, and they should know. They should know what to do. So it should be more than a screener. They're not just kind of looking to give you like a 25-minute test. They're looking. They're probably going to spend some time with you. I typically spend a few hours with patients to try to work it out. Yeah, I have anxiety and ADHD. I can normally tell which is which. Oh, yep, exactly, for sure. Yeah, again, with ADHD, it's not a symptom of ADHD to have anxiety. That's not a symptom of that. So they are very different in that way. Any tips on how to remember things you set down inattentively? Dude, for sure, man. Like, I do this all the time. So you have to find a system. Find something that works for you, like the little Apple AirTags. You could attach those to things, those little tile things, so you can beep and buzz. My phone, it's got a little ping on it, so I press the thing on my watch and it pings my phone all the time, because I'm misplacing it and leaving it around. Find a system that works. When you get in your house, you got a little key ring. You always put your keys right on the key ring. You don't go walking around your house. You put your keys right there. You got to find a system that works for you. Are psychologists covered by insurance? Most are. Definitely, most are. Thank you so much. I'm trying to figure out myself. Good for you. Saw you shoot someone with dopamine rig. Nice, my friend. Yep, that was me. ADHD, I have anxious thoughts. When I am unsure of a situation, anxiety, I make up situations to be, and ADHD and anxious thoughts, when I am unsure of situation. Okay, yep, for sure. Anxiety and make up situations. I feel you. I really hate in-person therapy. Makes me super uncomfortable. Thoughts on cerebral? I don't know what cerebral is. Is that a form of therapy? What don't you like? I'm curious. What don't you like about in-person therapy? Is there environmental ADHD? I wonder if my daughter, due to constant scrolling. Oh, I see. So with you're saying, like, through the use of social media, you think that has, there's something to be said about, the social media and the constant scrolling and the clicking and all that. I mean, these apps are designed to keep you interested. They are designed to give you a lot of dopamine. And so if people are used to a lot of dopamine in their life, other things are going to look pretty dang boring, Does health insurance cover these visits like normally? Yeah, definitely. Yep, sure they do. Sometimes you need a pre-authorization. So sometimes psychological evaluations can be a little bit more in-depth. And so I've noticed that probably 1 out of 3 insurance companies will ask for a pre-approval. So you have to get pre-approval from the insurance company first. Hi, Dr. Brian. I'm a psychologist from the UK. I think I may have ADHD. No kidding. Hey, what's up there? Denise, nice to meet you, my friend. All right, so what are you doing? What are you going to do about this, huh? My meds aren't working. I've been in constant state of annoyance and crying. Any advice? Oh, I'm sorry to hear that. That sounds, have you tried talking with somebody? That'd be the first step. Have you tried talking with somebody about that? I asked a question on one of your videos. Should I ask it here? Sure. Yeah. Let's talk about it. Are you accepting new clients? If you live in Wisconsin, we might be able to work something out. Hello from Uganda. I have major ADHD, but have responsibilities to keep help. Oh, it's hard. It is really hard. So have you been diagnosed with that? Your doctor, whoever diagnoses you with ADHD should recommend something for you, medication or different things. ADD and game addiction, any thoughts? Yeah, just like I was saying before, man, these games, they're meant to keep you hooked. A lot of people with ADHD love their video gaming, Thoughts on rejection dysphoria? I don't know what rejection dysphoria is. I know what rejection is, and I know what dysphoria is, so but I'm not sure. Could you spell that out a little bit more for me? Hi, so I'm undiagnosed at the moment. How do I cope? What does it say? How do I cope with fixating on people? You know, and that's interesting, because so actually, that could be a bit of an anxiety component there too. You know, what do you mean by fixating on people? You mean like what people think about you and stuff like that? I'm undiagnosed at the moment. Okay. Can you treat me? If I live in Washington State, I can't. I need someone who can officially diagnose me, but can't find anyone. Did you go to psychologytoday.com? Check out my latest video. Go to psychologytoday.com, and you should be able to filter by your area. How do psychologists get tested if we're used to the psychometric tests? They figure it out. Like the person that I went to, they find some pretty obscure tests, and they can give you some. Like if I had a psychologist coming to me, I'd figure out some obscure tests, or I would just get collateral information, talk to the patient, but then also talk to family. You know, you can't go wrong with getting a lot of collateral information. People who work with the person, things like that. Just easier to handle behind a screen. Uncomfortable with close quarters, new people, really bad with eye contact, and feeling a lot of judgment. Okay. Yeah, that sounds like a lot of social anxiety stuff there. How can we reset the attention span due to constant scrolling? How can we reset the attention? Meditation and mindfulness. Guys, you should, I'm going to be doing a lot more of this meditation and mindfulness in my own life too. It's just so helpful. Meditation and mindfulness is good. I'm in Wisconsin. Where are you located? No stinking way. I'm in the northern part of the state. I'm originally diagnosed with bipolar. But your vids helped me talk with my doctor about a reevaluation. Good for you. Oh, I'm so glad to hear that. Is self-CBT a problem solver? Self-CBT, I'm not really sure. So cognitive behavioral therapy, I mean, so I get the sense that maybe that means that you're trying to do that yourself. You're trying to change your thinking and things like that. I mean, yeah. I always advocate for working with somebody, you know. I was diagnosed with ADHD as a child. Is that the same as ADHD? Oh, yeah. So ADD, this is a good point here. ADD and ADHD, it's all the same now these days. So it used to be, back quite a while ago, there was ADD, and then there was ADHD. The ADHD was the hyperactive person, and the ADD was more the spacey, the daydreamer. These days, it's all been changed. It's just ADHD these days. And but there's 3 types of it. There's the hyperactive type, there's the inattentive type, and then there's the combined type. And so if you were diagnosed with ADD a long time ago, you would meet criteria for ADHD today, but you'd be the inattentive type. Newly diagnosed with ADHD and GAD, generalized anxiety disorder, trying to study for my clinical social worker license exam. Any advice? Oh man, take breaks. That's always my biggest thing, man. Take breaks. Study for a little bit, then come out of that, and then kind of in and out, back and forth. Can an MD diagnose, or just a psychologist? An MD can absolutely diagnose. My doctor says I don't have ADD based on no tests. My doctor says I don't have ADD based on no tests. Meaning that they didn't give you tests, or the tests said that you do not have ADHD. I did. I've been to everyone near me, and no one specializes, so I read the DSM myself. Oh, man. You know, you don't necessarily need a specialist. I always advocate for starting with your primary doctors, too. I'm in Wisconsin, too. Do you do virtual visits? I do. I do virtual visits. Yeah, absolutely. Most of my caseload, in fact, one day every 2 weeks I'm in the office. Otherwise, I'm doing everything virtually. Yeah. In my garage over there. I have a garage over there that I see all my patients in. It kind of smells like grass. So I don't know how great I'm doing. No, it's fine. The ones I went to said I said bipolar, but I don't have a serotonin deficiency. I have no dopamine. Okay. Why did you want to become a doctor? Oh man, I'll give the short answer. To help people? No, I don't know. No, it's much more involved than that. I mean, I'm a middle child, kind of, so I do a lot of negotiating and stuff like that, trying to understand people's perspectives and views. I've always wanted to kind of pull things apart and to help people. Absolutely, I was definitely a daydreamer type. Okay, yep, there you go. I missed the beginning of your live, but isn't ADHD caused by lack of certain vitamins, magnesium? No, ADHD is absolutely a dopamine issue, dopamine-related issue, ruffled truffles. Magnesium, though, can help. That's what I hear. Anecdotally, I've heard that from people. There's no great research on it there. Hi there, saw one of your videos earlier, and I'm hoping to find some useful info. Oh, happy to help. My friend Eric. Is overthinking a symptom of ADHD? Absolutely, like a busy mind like that. I hate my Adderall. I feel like I'm not even present in life, but when I don't take it, I'm everywhere. You feel like you're not really present? Sometimes that can be like a little bit, sometimes Have you talked to your doctor about that? Sometimes that can be like too high of a dosage. But check with your doctor. Is it possible to go from hyperactive to inactive through the age? Yes. Oh, yeah, to inattentive during the age. Yeah. Maybe that's what you mean. Usually when people get to be adults, they mellow out a little bit. You know, you don't see a lot of adults standing on their school desks, you know, in college and stuff like that. Like you would in elementary school. My children have ADHD as well. It's turning a lot of my past frustrations into guilt. Aw. I hear you. I hear. Too bad you're not in Missouri. Oh, I'm sorry. Yeah, pediatrician diagnosed with ADD in 1990. Said I grew out of it along with the asthma. Nope. Yeah, technically, you really should not be able to you shouldn't be able to grow out of ADHD. ADHD, again, it's a neurodevelopmental issue, and so you have ADHD. It's just part of the way your brain works. Your brain naturally is a little understimulated in the frontal lobe, and you have just a little bit less dopamine being pumped out, and so you gravitate toward things that are interesting and exciting and new, like all, you know, that video, like all those kinds of things. I didn't have any symptoms prior to college as far as I can remember. Okay, is ADHD or ASPD? Is it ADHD or ASPD? ASPD, are you talking about Asperger's? Or antisocial personality disorder? I'm not really sure. ASPD, sometimes the acronyms are kind of funny in this field of psychology. Started my primary, got me Vyvanse, looking into seeing the behavioral psychiatry. Nice. Vyvanse is a stimulant medication. Stimulant meds really help, and I had an in-depth, whoops, where'd that one go? Oh, dang it. I don't know why, man. Like, I don't get this whole TikTok thing. I'm trying to, like, read your guy, you know, my finger's on the thing. I'm trying to, like, read your guys' comments. Then out of nowhere, all of a sudden, it'll be like, it'll just, like, scroll to the bottom. I'm like, okay, well, I was trying to read this person's thing. So I'm sorry. If I miss a comment, just let me know, and just keep asking. Why does caffeine act weird in me? Monster Energy makes me more sleepy. Oh, interesting. You know, for ADHD, you know, some people swear by this. You know, they drink caffeine and it actually mellows them out. It helps them focus and stuff like that, which, you know, I'm a middle child too. Must be a prerequisite for becoming a psychologist. No stinking way. That's awesome, Denise. Yeah. Is it possible to go from inattentive to combined? Sure. Yeah. How do adults get diagnosed? I just made a video on this, so you should check that out there, listen, 79. Yeah, it starts with, you have to get some kind of an evaluation. So that can either be from a primary doc or from, like, a psychologist like myself. Tally says, no meds. Oh, antisocial. ADHD is very different than antisocial personality disorder. Antisocial personality disorder are like, that's like a lot of people who would do a lot of criminal activity. But maybe you're asking this, is there a similarity? Are they? Yeah, a lot of people with antisocial personality disorder can also have co-occurring ADHD. Definitely. Can ADHD develop later in life or born with it? You're born with it. But here's the thing, it might not be noticed early in your life because maybe you're bright enough to compensate, or maybe you weren't challenged, your executive functioning was not challenged, and so later on in life, it's sometimes when people end up going to college, they find that they just stink at school. All of a sudden they start doing terribly because nobody's calling them in the morning to get them going. You know, nobody's, barging in their room like, dude, you're gonna miss the bus, anything like that. It's like you're on your own. The teacher doesn't care if you're there or not. If you miss a class in college, it's like, whatever, you're digging your own grave, buddy. I'm not gonna, the teacher's not gonna hound you. And so a lot of people with ADHD do struggle with that. What are your thoughts on neurofeedback therapy? If you have one, I do have a good question there, Kelland. Neurofeedback is very cool. So neurofeedback is, it kind of gets you better understanding as to how to control your mind and your awareness. So I like it. I think it's good. Not a lot of research on it though. Oh my gosh. I struggle with motivation, and also I'm a perfectionist, so I just sit and stress all the time. Oh, I'm sorry to hear that, Katie. Live in Southwest Kansas. Providers who refuse to prescribe medication for ADHD in adults. No stinking way. Huh. That's not, they are not following the research then. I'm in the north, and it's hard to find care providers, and I pay out of pocket, so hard to find someone. Oh man, Peacock. Can you prescribe meds or help find someone to see in Wisconsin? I was thinking about doing that, like helping people, people who aren't set up with a provider, by like working with you guys to see if I can help you find somebody. I was thinking about doing that. I don't know if you guys would find that helpful or not. But yeah, Psychology Today, I always recommend that website. Psychology Today, it's you know, you'd think I was sponsored by them. Like this little shirt should have like a little pin here that says Psychology Today on it. But I'm such a big fan of Psychology Today because most people, most therapists or licensed therapists or psychologists are on Psychology Today internationally, so across the world. And so you can go on there and you can find someone near you. From Phoenix, it's hot. My grandson is about to start kindergarten. He has 30-second attention span. Hey, Jennifer. Okay. Yeah, it's tough. Do people with ADHD have problems with addiction? Yeah. People with ADHD are definitely drawn to the self-medicating stuff. My wife is ADHD, diagnosed at 40. What advice can you give for partners of people with ADHD? Well, you're doing an awesome job right here, my friend, in tuning into this little live thing. Because obviously, you know, she's important to you. You brought her up right now, and you're talking to me and stuff, and you're probably doing your own self-research and whatnot. So that's awesome, man. You know, any kind of, you know, anything you can do to help build your empathy and your patience with your spouse is a really good idea. I have ADHD. My spouse, man, it's a struggle, you know, it is a struggle. If she were out here right now, she'd be letting us know, you know, she'd be like, oh boy, you know, sometimes I'm on my game and other times I'm not. So, but the first step is really kind of understanding it. I find that if you understand something, you have a lot more patience, you know, for a 36-year-old woman. Hey there, Mickey, now that my son has been diagnosed, I'm looking back and wondering if I have it too, you know. If a parent has it, it's about a 40% chance that their kid is going to have it. My prescriber seems reluctant to prescribe stimulants even though they help I have a diagnosis. So that's the thing. Stimulant medications, it's in a whole different class. It's different than antidepressants and stuff like that. Stimulant medications, they are they're a controlled substance, you know, and they are, you know, they have a street value. So, you know, when you go in to get medication, stimulant medication, they check your ID. You can only get it a month at a time. You know, sometimes the pharmacist gives you some funny looks. I don't know. It's just a whole different thing. There's some stigma with it for sure. But doctors, when they prescribe stimulant medications, they want to be sure that they're doing it right. And so that's why they would usually have you do an evaluation. Hey, Kay, how's it going? What do you recommend for helping with the dopamine we're missing out on? That's a good question. If you're finding yourself kind of like feeling a bit more disorganized or inattentive or kind of restless, you know, do something that is going to give you that dopamine fix, kind of, you know, that's kind of the best way to say it. And so, you know, you see this with kids a lot. If kids are starting to get squirrely, what do? You take them out for recess. It's like, you know what, I know this isn't the time, you know, that we usually have recess, but everybody's kind of getting really squirrely right now. And that's just a signal that, hey, they're probably a bit dopamine deficient right now. Let's get them doing something. And so exercise is a really good thing, you know, getting outside, running around a little bit, playing with the dog, you know, something like that, kind of getting that dopamine a little bit. And you take that kind of break, you'll be surprised that you go now and you sit in front of your whatever book you were reading a second ago, and you'll be able to focus a heck of a lot better. You know, you take those breaks, it's really going to be helpful. Dr. Brian, do you think someone should have a PhD or PsyD in order to evaluate and diagnose? It doesn't matter. Both, in terms of evaluation, I would say both of those are equivalent. Usually PsyDs are better for like clinical, like working with patients in more of a therapeutic sense. They have just more clinical training in that way. PhDs are usually much more research-based and academic. He also goes through some serious meltdowns. Oh man, that's tough. Can ADHD be treated without meds? My son is in college. And it just disappeared on me. Yeah, absolutely. So your environmental or behavioral changes, you know, with ADHD, the what I always tell people is like, you just have to get really good at systems and routines in your life. And so setting up, you know, automated systems, for example, you know, so you wake up in the morning and let's say that you're always forgetting to take your medication. Like, what's something that you don't forget in the morning that is going to help you remember? So like, for example, you know, maybe you always brush your teeth. You got that rhythm down. Put your medication like on your toothbrush, like, you know, sitting right there or something like that. You know, that's a system that is going to make it, you know, fail safe. You're just going to do it. Other things that you can't remember, like, so for example, if somebody tells me something right now, like, hey, you know, Brian, make sure that you, I really need you to call so-and-so tomorrow. You know, what am I going to do? Like, okay, like, I got you. Like, am I just going to try to remember it? Like, nah. Like, I'm going to plug it into my phone or tell Siri, hey, Siri, remind me tomorrow at 12 p.m. to text so-and-so. And now I'm good. Now it leaves my brain and I'm all set. And now tomorrow at noon, I'm sitting there doing my thing, you know, playing Nintendo or something. And all of a sudden my phone, you know, buzzes, you know, and it's like, hey, you need to text so-and-so. And I'm like, all right, somebody just sent a little thing. I don't know how to look and see what just happened just now, but somebody sent a little thing. Thanks for that little thing. I'm like such a noob on TikTok when it comes to going live. This is only my second time going live here, and so sometimes these little things flash on the screen, carrots and diamonds and these kinds of things. So I'm trying to figure it all out, y'all. But I know that they're good things, and so thanks if you're doing that. I suspect having ADHD 10 years ago, and I'm finally seeking diagnosis. I just keep putting it off. Look into it. Freak to you with some flowers. I know that that's good stuff. Thanks for the flowers. All these flowers. Hi, Doc. Brian, have you ever come across a link between ADD and dopamine high chasing? Yeah, absolutely, for sure. We were just kind of talking about that a second ago. You might find too that people with ADHD, they sometimes they like to do this kind of thrill-seeking stuff. You know, again, because they're deficient in this dopamine, and so they are bored. They get bored easily, and so they're looking for things to do. Hi, I have ADHD combined type. Okay, I have chronic fatigue. Would a stimulant be better for me? Talk to your doctor about that. But you know, sources say yes on that one. Is that what the what's that thing called? The magic 8-ball. I can't get stimulant medication until I finish a drug test, but I just stopped Strattera a week ago. Okay. Yeah, and that's the thing. They can do random kind of tests with you. They can count your pills, you know, to make sure that you got all your pills there. How do I find a doctor that won't just give me the iPad self-diagnosis quiz and reevaluate me? Dude, totally, man. And that happens sometimes. You know, the terminology I would lose is I'm looking for a comprehensive psychological evaluation or a comprehensive neuropsychological evaluation. Those are the things you're looking for. I was just diagnosed with ADHD. Why for a year did they assume I was bipolar? You know, the highs of the manic episode with bipolar disorder. So you got bipolar disorder. In order to meet criteria for bipolar, you need to have a manic episode. And those highs can look like the disorganization and the inattentiveness and the hyperactivity and the impulsivity with ADHD. So I can kind of see it a little bit if I kind of squint my eyes a little bit, but in a lot of ways, they're very different. Bipolar disorder is very different. A case says, thank you, seems pretty obvious when you say that, but I needed that advice. Hey, awesome, my friend. Very cool. Glad I could help. Do you have a preferred treatment, or is it unique to each person? Yeah, I try to tailor it to each person, but you know, the one thing that I'm telling you, if there's one thing, it's like, what can I do? You know, the systems is a big thing, but this mindfulness stuff, like, Happy 4th of July, everyone. I don't know if you guys heard those fireworks that just went off behind me a second ago. Freak to use, give me presents now. Hey, thanks, my friend. I appreciate the presents. That's probably a good thing, too, so thanks. What was I talking about? Oh, boy, here we go. Last time I took my medication. Oh, I'm about due for my second dose of my medication for today. So this is why I should have done that before I went live here with y'all. What was I just talking about? Dang it. It left me. Do you have a preferred... Oh, there it is. Do you have a preferred treatment, or is it unique to each person? The preferred... this mindfulness stuff. Okay. It's coming back to me. It's coming back. You just got to give me a second here. It's coming back to me. The mindfulness stuff, if you guys haven't looked into it, man, that's a really good thing. Really good idea. First attempt with psychiatrist went bad. Wouldn't give me an assessment. Nervous about trying more. Oh, dang it. I don't blame you for being nervous. I'm sorry it went bad. You know, it's just like any relationship. You got to find somebody who clicks with you, you know. We're not all created equal. All psychologists, any person is not created equal. So, I always recommend trying to find somebody who jives with you. Dopamine chasing is a thing we do. There you go, Zenroth. Thanks for being here, giving advice. It's so appreciated. Oh, I appreciate you, bunny. No problem. Glad to be here. I seem to have only 2 modes. Hyper-focused or whatever the other one was. It just disappeared. Why does it do that, you guys? Why does this do that? I don't know. TikTok is so weird. My son has ADHD, and the more research, the more I think I have it too. I use a stat quite a bit, but about 40% of a chance that your kid's going to have it if you have it there. Yes, this is Jessica. Says, hi from Seattle. Well, hey, how's the weather in Seattle, my friend? How to fix perception of time. I have severe ADHD and I'm medicated. Yeah. So it's easy to lose track of time, isn't it? Man, I'm telling you, the reminders on the phone or the watch. I have my watch synced with my phone. And so when I got to do things, it's buzzing me, you know, like, you know, if my wife was to come out here and if she was to say, hey, 10 minutes until dinner's ready, what I would say is, you know, a good idea for me to do if I'm thinking about it would be, hey, Siri, remind me in 5 minutes to start wrapping this up, you know, and then I'm going to be on my roll. And then Siri's going to be like, beep, 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 start wrapping this up, boy, you know, and then I'm going to be, you know, wrapping it up. So manic phase are strictly unmotivated. Or strictly unmotivated, okay. Manic phase or strictly unmotivated. Are you saying that, Leah, during the manic phase for you that you feel really unmotivated? We're commenting too fast. It updates once there are too many. Is that what it's doing? Lame mellow. If I'm missing your comment, please ask it again here. I'm really. You know, the thing is I'm like, I see you guys see these TikTok lives like periodically, and I don't know, man. It just feels like. I've only watched a couple of them, but I feel like a lot of them are, I don't know. I want to be helpful. I want to be helpful to folks who got stuff going on here. Pretty Prince, hey, my friend, do I have ADHD or do I just live in a world that commodifies attention and we can't handle it? LOL. You know, there's something to be said there. Well, here's the thing about all mental health diagnoses. It is all culturally based. In our culture, you know, in a kind of Western society, we value productivity, getting things done, paying attention. You know, you got to do stuff. You got to do stuff, and you got to work for yourself. You got to be autonomous and independent. That's what we value in Western culture. And if a person has a particular brain that works against that, you know, like in school, you're supposed to sit down, look straight ahead, and focus. Don't talk to anybody around you. You know, turn in your assignments on time. I'm gonna fill your brain with all this information, and there's a quiz on it at the end of the week. Like, for some people's brains, that is just like not. That is not, but that's how our culture is. And so absolutely, in our culture, some of these things are considered mental diagnoses, whereas in other cultures they would not be. Same as like schizophrenia, for example. Schizophrenia, you know, where if let's say you're hearing voices or seeing visual hallucinations. In other cultures, you might be a prophet. You know, you might be somebody actually pretty important. And this might be a real value in your experience, but not in Western society. It's a problem. Tips and books for classroom teachers, Miss M and the Monsters. I love that name. That's and the Monsters. That's hilarious. Anything, you know, I would recommend anything by Barkley, Russell Barkley. He has some good ones that are out there right now. There's some other good ones too. Gosh, when people ask me about the books, man, I'm terrible at remembering those kinds of things. But Russell Barkley is a good name. Do you have any ways to steer away from dangerous high chase? I don't think about repercussions. Yeah. That's a tricky one. If you don't think about the repercussions when you're kind of doing that thrill-seeking stuff. Self-awareness is so important. You know, and again, I'm going to go back to this mindfulness thing. Mindfulness, here it is. Okay, so you don't have to Google this. Let me tell you what this is. Mindfulness is this process of being present. Okay, it's just about being in this moment and experiencing whatever it is that's in front of you and not getting lost in your thoughts. It can be very easy for humans, and especially folks with ADHD, to be lost in thoughts. If you're lost in thinking, or if you're impulsive, you just kind of do things on a whim, we need to figure out how to slow ourselves down. Like even now, you can hear me. Like I'm like talking, I'm like going, I'm scrolling through, and there's a lot going on right now. In this moment, like what am I feeling? Like in this moment, you know, as I think about it, I feel like, for example, I can feel my fingers touch. I can feel the cool breeze. It's a little sticky here, you know, actually, but I can feel the cool breeze. I'm being mindful. I'm being in this moment. If you practice those types of mindful moments throughout the day, that's really, really great for the ADHD brain. It gets us to just settle ourselves a bit, which is what the medication will help do as well. Helps you settle yourself, and this can be really helpful for people who have impulsivity-related issues. Is there any natural medicine that helps? Somebody asked, Alpha Brain, etc. Unfamiliar. Don't want to take meds. No, I don't blame you for not wanting to take the medication. Medication can be very helpful for folks who philosophically agree with that kind of a thing. I would say that, like magnesium has been tried. fish oil, vitamin D, things like that. Make this video, please. I want to go back and watch this multiple times. Oh, make this a video? I don't know how to do that. I'll figure it out. I'll try to figure it out, maybe. Maybe a YouTube? I don't know. Last psych left practice. My new is far too demanding and try over medicating. Oh, dang it. Again, we're not all created equal, you know. Second, talking about memory loss. Okay, memory loss. Yeah, absolutely. So here's the thing. As humans, we don't just like, you know, memory problems really isn't a thing, you know, unless you hit your head, you know, unless you have like a TBI, like a traumatic brain injury, or unless you're like really old and you're starting to suffer from, you know, the degenerative process of old age, or of like an illness like dementia or something like that, dementia process. But most people, you know, it's not a memory issue. It seems like it's a memory issue, but what it really is it's a I just got a notification that my kid just walked out of my kid's napping right now upstairs. She's 5. She's finishing up her nap, and it's 3 o'clock right now. And I just got a notification that she opened up her door. So she's and this is the thing, the smart, you know, kind of bulbs, smart light bulbs. You forget to turn off your light, you know, just get a smart bulb, and have it turn off every night at 8 o'clock. You know, something like that. You know, those kinds of things are so you automate them, so you don't have to worry about it. But anyways, so the memory related issues, it's usually because you're not paying attention, right? So if somebody's talking to you, they're like, hey, you know, remember, you got to remember to pick up this and that from the store, but you got to do it in the afternoon because I like my groceries to be fresh, you know, so you got to pick it up in the afternoon. I would say probably about 2 or 3 o'clock. You don't want to start pushing 4 or 5 o'clock, because once you kind of get to that time, then you start running into the rush of grocery, and you're like trying to process all this, and you're like, oh my gosh, okay, wait a second now. So pick up groceries. What were the groceries again? Shoot, the milk and the bananas, and what else was it? Okay, but not too late, but also not too, you're trying to remember all this stuff down. It's very difficult, especially when with ADHD you're getting a lot of distractions. Things are coming into your awareness, and it's taking you away from the moment. And that's the thing with ADHD, is that a moment of got the kids playing in the pool behind me, so see, this is the thing, so case in point right now. So that kid just yelled behind me because he's in the swimming pool, in somebody else's neighborhood. I'm trying to focus on you guys, but that yell just now, it went into my brain as though it is just as important or a priority as whatever it is that's in front of me. So if somebody's talking to me, and then all of a sudden a bus drives by, most people are able to kind of filter that out and like, that's a bus, it's not important. But for some of our brains with ADHD, it's hard for us to regulate and understand and filter out the unimportant information from the important information. And so that bus drives by, and I'm like, what is a bus doing driving by at this time? And that's a flat-nosed bus. You don't really see those kinds of buses that much anymore these days. I bet, like, when I was a kid, like, yeah, the flat-nosed bus, and you start going off like on this thing, and this person's trying to talk to you, sitting in front of you like this, because again, your mind can just kind of like run away from you like that. Your Brian and my brain have so much in common. You explain things the same way I do. Oh yeah, very cool. I hope that's a good thing. My focus is like Russian roulette. Let's see what happens today. Totally, man. What about difficulty with change? Oh yeah. Okay, so here's the thing, Mickey. Folks with ADHD, we like our routines because it helps keep us organized. Sometimes life can be a bit chaotic for people with ADHD, but we do best with structure. And we like things, and sometimes we like things to be kind of just so. Difficulties adapting is pretty common. That's an executive function issue. So that's the part of the brain that's affected by ADHD. That's so difficulties with adapting and things like that. So right. How does someone with a psych degree get in the field? Oh, dude, man. You have a psych degree, so you have a bachelor. I'm guessing you're saying you have a bachelor's degree. So in order to meet with patients one-on-one and do therapy and be licensed for that, you need at least a master's degree. Master's level therapists cannot administer tests. They can do like little screeners and stuff like that here and there, but they can't administer tests, which is why I became a doctorate. Why I became a doctor. I wanted to do evaluations and assessments as well. I didn't want to be limited in how I could work with a patient. And so my only limitation these days is medication. I can't prescribe medications because we don't, psychologists are not allowed to prescribe in Wisconsin. There's like 4 or 5 other states where you can, but not in Wisconsin. Have started to realize that I may have ADHD. What are the first steps I should take? First steps I would say is we need to confirm that for you. And so a neuropsych evaluation or a psychological evaluation is the good way to start. You can talk with a psychologist about that, or your primary medical provider. That might be a good idea. You just got diagnosed with ADHD, Harper. Okay. How's it going? How does it feel for you? Hello, friend sent me your TikTok. By the way, my phone captions lives for me. My phone captions lives for me. I don't know what that means, but that's cool that your friend sent me that your friend sent you my TikTok. Awesome. Why do I have structure at work but not at home? I'm medicated. You are medicated. Okay, why do you have structure at work but not at home? This is very common, and also especially common for people with like students, school, kids. They oftentimes do a heck of a lot better at school because the structure is kind of built in. At work, you go in, you punch in, you sit at a certain desk, you sit there, and you can expect to see the same people. You can expect the same kind of layout and landscape, the same kinds of customers maybe you're working with, the same kinds of product that maybe you're working with. You take your lunch break and you do this and you that, and the water fountain's over there, and so-and-so is always doing this over there. It's structured, and that is just... that helps us stay mentally organized if there's a natural structure to what we're doing. And that's why this year, man, with this whole COVID stuff, parents had a heck of a hard time dealing with their kids, at home, because this is like the worst, for ADHD folks, going from a structured environment like school and now having to do that same schoolwork at home in an unstructured place. The parents who did the best, who had the least amount of troubles with their kids, were the ones who could stay really structured. How hard is it to differentiate bipolar and ADHD in adults? I mean, it's not really that difficult, because a manic episode in a lot of ways does look different than ADHD. I mean, manic episodes are, they come and go. Like all of a sudden you'll be like, for like a week at a time, you'll be like super, I can do anything, and you'll make all these risky decisions, and you'll be very impulsive and stuff like that. That's a manic episode. But then you'll come right back down to a depression and more of your stable self, which again with bipolar is more depression. With ADHD, it's not like that. It's not like you got like this week of like, bam, and then after that, nothing. It's like ADHD, it's a constant thing, and you've been dealing with it your whole life. Do you have any thoughts about CBD and ADHD? Good question, Mickey. No, I don't have I don't have any thoughts. CBD is a very difficult thing, man, because it's just not regulated, and so there have been some studies that are out there. I mean, and some parents swear by it, that I had a parent just a while ago tell me a little bit of CBD behind the tongue, has really mellowed their kid out, and really it has been a really great thing in terms of attention and focus. But then you have some other people who it's like that hasn't worked at all, with my kid. And how do you know? Because since it's not regulated, the potency of some CBD is different than the potency of another, and so one parent's experience is going to be different than another person's experience if they got the CBD from different places and all of that stuff. So there's not a lot of great research on CBD, but hopefully it's coming down there. Laugh Out Louder says, have a great day. You too. I hope you have a good 4th of July if you're in the U.S. Does PTSD have the same symptoms as ADHD? It can, like a kind of a hyper awareness, or like a sensitivity. Emotional sensitivity is very common in ADHD, and so people with PTSD can find those kinds of things too. But the difference is in ADHD you don't necessarily have trauma. You don't have trauma. Trauma is not a symptom of ADHD. You certainly can have trauma, but if it seemed like you were going through your life and doing just fine, and then a traumatic event took place, and then your brain was forever changed, that's going to be more of a trauma response and more of a PTSD kind of thing than was ever an ADHD thing. But it can be difficult at times to kind of figure that out. CBD doesn't do anything for your ADHD. THC helps, okay? Can't focus without smoking. The nicotine, yep, for sure. Why is it so hard to get diagnosed and put on the right medication? Well, I think doctors are trying to be careful with ADHD. With our society, and I was kind of like alluding to this a little bit later. In our society, in the Western culture, we do value productivity and getting things done, goals and solutions, and looking forward. And you're only valuable based on how much you can offer to society. That's the Western way. So. If somebody's not performing because they're just a little bit more of a laid-back person, they don't have that kind of like get up and go, or their personality is a little bit different than that, they're going to find they might struggle in life a little bit. And so, if you're struggling in life and you're kind of feeling like you're a disappointment in a lot of ways, you may want to just be like everybody else. And so, maybe I have ADHD. And that could be, it could be, but maybe not. And so, we understand, therapists, psychologists, medical doctors, we understand that there is a lot of pressure on people, and especially on our kids, to perform and get it right and not slack off and all that stuff, man. And that's a lot of pressure. That is a lot of pressure. And so why not give them a stimulant medication if it means that they will be productive? That's the problem. That is the problem. You were diagnosed with ADHD after TBI. Still question it. Yeah. Well, so what I was saying before is that the front of the brain is what's responsible for the ADHD stuff. Attention, concentration, focus, and all that stuff is all, about the prefrontal cortex. And so if you've had a TBI that's affected your prefrontal cortex, that could absolutely lead to a lot of symptoms that look a lot like ADHD. Yeah. I don't blame you for kind of questioning it a little bit. Oh, dang it. Hi, I'm new here. I have ADD and anxiety, and I'm dyslexic. Well, hey there, Maria. Nice to meet you. My name is Brian, and thanks for coming on in. I was diagnosed 18 years ago, and I'm on medication, but I still have days when I can't focus. Oh, yeah. That's the thing. Medication is very helpful, but it's not a silver bullet. It's not going to, take it all away all of a sudden. So you have to make behavioral and environmental changes as well. I was able to cope with ADD for a long time, but nursing school triggered worsening of symptoms. I'm sorry to hear that. Nursing school triggered a worsening of symptoms. Okay. Sluggish cognitive tempo. What was the question there? Something about that? What to do about sluggish cognitive tempo? Yeah, that's that daydreaming stuff. That's that kind of staring out the window, slow, fatigued, processing speed is slow, all that kind of stuff. I don't know. It's tricky. My gut instinct kind of tells me, you're going to have to, if that's part of who you are, then, gosh, if there was a way to embrace that, that would be ideal. If there was a way to embrace that. Don't be who are those guys who work on Wall Street and they're like, hey, or an auctioneer, I don't know, don't go into a fast-paced thing if your brain can't, do that, yeah. I'm new here too, dog. What's up, Rico? How you doing? You guys crack me up, man. Because stimulants are performance-enhancing drug. Western culture is focused on performance. We are focused on performance. What if your earliest memories were traumatic and blocked out until you got to adulthood? Have you worked with a therapist? That would be a great thing to work with a therapist. It does happen periodically. Pretty rare. The event has to be pretty dang significant. I would say Charizard. I don't know why I said it like that. It was just if it seemed like is medication enough to stop executive dysfunction, or is CBT also needed? Medication can be extremely helpful in about 90% of people, but you have to make environmental changes. You have to make behavioral changes. Oftentimes medication can be that piece that you need to make those kinds of changes. ADHD diagnosed by interview. How do I know I wasn't just lying to myself and the doctor and I'm not just lazy? Man, I always think that, it's a very common one. I always think that, there's something behind being lazy. You know, I don't feel like people are just late. You know, those things are learned. Those things can be learned, absolutely. So a person can learn that it's just, you know, that everybody does things for them, for example, and that they just sit around and people can, you know, people bring them this and do this for them and this, that, and the other thing. That can absolutely be a learned trait. So that would be important to figure out, and maybe you can, you know, a person can work on that with their own therapy. If this is affecting your life in multiple ways, if you also have the other symptoms too, so it's more than just laziness. You know, laziness or not getting things done or not doing things that aren't, you know, urgent, those things, that's just one piece of ADHD. There's a lot of other pieces to it too. What advice would you have for someone with ADHD inattentive type going into nursing school? Hey, my friend, thanks for the question. May Alyssa? Or Maya, maybe, ADHD going into, I always say, I feel like a broken record, because these questions are so good, you know, but, I love that question, Maya. I would say, that, you know, taking breaks, in school, accommodations, if you have a diagnosis of ADHD, you can get accommodations. In the school setting, ADHD is considered to be a disability. Now that's not the case in terms of like, legally you're not disabled, so you can't file, you know, for disability and you know, and get a payout for having ADHD, but you can, but it is considered a disability in the eyes of the school. And so if you have a legit diagnosis of ADHD and you have paperwork to back that up, you know, you can work with your school admissions or the disability resource center at your college or at your school and get lots of accommodations. You know, more time on tests, you know, breaks, you know, somebody to take notes for you, all those kinds of things. My spouse is an entrepreneur and diagnosed ADHD. Any tips? Dude, ADHD and entrepreneurship, that is like, they go hand in hand. You know, they go hand in hand. Any tips? Stay focused. Stay focused. What was this just now that came through? There was a paper, a little paper airplane, or what was that? Like a paper origami thing that just came through. Thank you for whoever sent that through. I don't know. I'm a noob on TikTok, y'all, so you guys are bearing with me here. Thank you. I know that that's probably a good thing. But help keep them focused and structured, the entrepreneur. What kind of doctor should I find to discuss medications? That would be a medical doctor, so either a psychiatrist or a your family doc or primary doc or something like that. You know, and it doesn't have to be a doctor. You know, nurse practitioners and things like that. Jennifer with throwing a flower over here. Thanks, my friend. Appreciate that. Can ADHD trigger tics? If so, how do you handle that? That's a great question. Tic disorder, like Tourette's, and ADHD can absolutely kind of go hand in hand. Hey there, Ubu247. Thanks for the flower. Appreciate it. They can go hand in hand, absolutely. ADHD, autism spectrum, and tic disorder, you know, like Tourette's, they can sometimes occur together there. And some cake. Throwing some cake over here. Thanks, Ubu. I don't know what these things are. How do you handle the tics, though? A lot of times tics can be, hey, Jenny, thanks for the cake there, too. Appreciate it. Tics can be exacerbated by anxiety. And so I would focus on the anxiety, probably. My doctor suggested neuropsychologist. Thoughts? The best way. That's the best way for addressing ADHD, because it's a neurological issue. I want to take medication, but there's too many bad side effects. What do I do? It depends on what you mean by the bad side effects. I mean, you know, I wonder what side effects you're talking about. There can be some side effects that people, you know, people just can't work with, which is absolutely, I totally get it. So then it's going to be on your shoulders to do a lot of behavioral changes and environmental changes. How to ADHD is a great resource on YouTube for people seeking answers on ADHD. I think I did see that one. I want to take medication, but there's too many. Oh, I read that already. Do you think people with ADHD are drawn to fast-paced, urgent response types of professors? Yes, they are, Casey. Absolutely. I want to take medication, but there's too many bad side effects. What do I do? Oh, I already read that. Man, I know I have untreated ADD. I'm reluctant to see an MD for it. Okay, why are you reluctant about that? Can you overcome ADD without medications? Absolutely, you can, Neil. Yep. But you have to. It's about Automating processes, keeping yourself disciplined, structuring your life, building routines. That's what it's about. Post-it notes, binders, bins, folders, timers. Those are going to be our best friends for those of us who are having trouble with the ADHD. Those are bad. So I'm going to have to get going in just a few minutes here, y'all. So if you have any, these questions are just awesome. You guys are really doing it here with these questions. But I'm just letting you know that I got to get going in just a few minutes. What is inattentive type ADHD? My therapist thinks I might have it. I'm getting tested next month. Okay, Cosmic Apple Pie, yep, you betcha. So there's 3 different types of ADHD. There used to be an ADD and an ADHD, and now it's just all ADHD. But there's 3 types. There's the inattentive type, there's the hyperactive type, and then there's the combined type. Inattentive type is that individual who doesn't show a lot of displays of restlessness or impulsivity or hyperactivity. They're usually the daydreamer, the ones who's zoning out, who's missing details, forgetting to turn in assignments. That's the individual with the inattentive type. I'm new here and I have ADHD all my life, and 10 years ago I had a TBI and damaged my frontal cord. Oh, no kidding. Oh, geez. I want to take medication, but there's too many bad side. Oh, I read that one again. Oh my gosh. That was a good idea to keep putting it up in the thing, though, so I don't miss it. What do I do when ADHD meds make you super emotional? For sure. Well, that's one of the side effects of stimulant medications, is that they can increase irritability. Absolutely. Usually, sometimes it can be a dosage issue, so you can talk to your doctor about, or your prescriber about a dosage change, or maybe it could be a different medication that could be helpful instead. You have ADHD and have trouble sleeping, for sure. Is your mind kind of racing at the end of the night like that? How early, what age can ADHD be diagnosed? I usually diagnose not until about 6 years old. I like to kind of give the kids a chance to be in school for a couple years. You can absolutely overcome ADHD symptoms without medication, 100%. It depends. Let me say the caveat. It depends on the severity of the medications, and it depends on how insightful you are and how much help that you have. And how much research you're doing. It just depends on a lot of different factors. But the short answer is, yeah, absolutely. Why do I refuse to allow myself to go to sleep, man? It can be a lot of different things. I have the same trouble. I am up too late in the evenings. Hi, where are you located? Cynthia asks. I'm in Wisconsin. Nice to meet you. I want to take medication with it. Oh, man. Okay. What would you recommend to your 6-year-old kid? She's always in trouble. Help. Oh, I'm sorry to hear that. I have a 5-year-old and she's kind of like a little bit rowdy too. I know she's up from her nap, so she probably hear me over there. But yeah, oh, she comes probably. So how do you help your 6-year-old? Make sure you give those dopamine, fill her brain up with dopamine where you can, in an active way. Get her body moving and do those kinds of things. Is clinical psychology different than psychiatry? Yes, absolutely. Psychiatry, you're a medical doctor, and your focus is on the biology and the chemistry first. Clinical psychology is all about diagnosis and treatment, and I'm not a medical doctor. Tips on how to cope with compulsive behaviors. Yeah, so that'd be like an impulsivity kind of a thing. Mindfulness. If you've never heard of mindfulness, I should do a thing on mindfulness. If you guys have never heard of mindfulness, you should definitely check that out. For those of us who have ADHD, and if we are either inattentive or we're hyperactive and impulsive, or compulsive in that way, mindfulness can be really helpful. Teacher with the flower, chucking it over here. Thank you very much. Appreciate that. Are people with ADD more inclined to become addicted to opiates? Yes. Yep. Folks with ADHD do a lot of self-medicating in that way. How can you tell if you have ADD or ADHD? I love the all caps there. How can you tell? You have to get evaluated. A neuropsychological evaluation or a psychological evaluation is the best way. And you can get that through a psychologist, like meeting with somebody like me, or through your primary medical provider can either do it themselves or hook you up with somebody who can. Tips on making snap decisions. Yeah, there are some good ones out there. Again, mindfulness is a good one. Mindfulness helps us slow ourselves down a little bit. Stop and think. If you Google the term stop and think, I think there's a program about that. Thank you, super important, informative, says the user. CEH, you bet. Yeah, you bet. Happy to help. Okay. How do you feel about Vyvanse? It's a stimulant medication, can be very helpful for a lot of people. It can be a good one. It's expensive. That's an expensive one. That one's more expensive than the Adderall or the Ritalin and stuff like that. Any tips on how to keep your ADHD symptoms from hurting your neurotypical partner? Yeah, maybe I'll just end on this conversation here, and then I'll just kind of I do see patients, by the way, virtually, mostly, but not out of state. You have to, if you're a psychologist or a licensed professional, you have to see the patient in the state that you're licensed in, because every state is different as far as licensing. And so, oh crap, what was that one? Oh, with relationships. So my wife's sitting right here, so I got to talk this one up a little bit. Let's see. Well, your wife's always right. That's not part of it. Okay, no, that's not part of it. Let's see. So, well, what I do, what's really helpful, my wife and I try to get on the same page as far as, she does a lot of educating of her own to try to understand ADHD. So that's really important. If you have a person, if you can encourage your partner to try to understand it or learn along with you or participate in those meetings with the psychiatrist or the psychologist or the medical doctor, whoever's talking to you about the symptoms. Empathy is really important for my wife to know more about ADHD. It not only does it feel good for me, because I feel like it's she's wanting to understand me and values where my brain is having a hard time. She values that, and so that makes me feel good. And so it helps just a connection. It's almost like it's almost like I wouldn't look at it like this. You don't want to look at your ADHD as being, the ADHD symptoms as being like your enemy or an opponent. But if you and your spouse can have like a shared interest in trying to help keep you productive and motivated and interested and doing the same things, so thanks for the flower, sent along a flower just now. Appreciate that very, very much. But if your partner, lost my train of thought. There it goes. See how quickly that can go, y'all. Alan, thanks for the rose. Appreciate it. But here's what I do. I do a lot of timers and stuff like that. Like if I know my wife is doing something, like if she has like if she had like a doctor's appointment or a phone call from the doctor, and she was a little nervous about the phone call or something like that, I might set a timer on my phone, like, because I might forget to ask her about it. Here we are talking, and we're talking for 30 minutes, and she just had this phone call, and I don't even remember. I'm just like doing my thing and whatever. It's not that it's not important to me. It is important to me. My wife's health is very important to me. It's about as important as it gets, but it doesn't matter. It doesn't matter. It doesn't show up in the brain as being urgent or whatever, or any of those kinds of novel. It's not any of those kinds of things. And so it's not popping up as being a focus for me in those moments. So I set a timer on my phone or something like that. I say, hey Siri, remind me at 5 o'clock, which is when I get done with work, we'll say, remind me at 5 o'clock to text my wife and say, and ask her how the appointment went. That's, and it's that easy. 5 o'clock comes around, I'm doing my thing, and all of a sudden my phone, kind of buzzes. Hey, text your wife, ask her how it went. Oh, hey sweetie, how did it go? Are you okay? How did the phone call go? And it's not like, oh, that means that you don't really care if you need your phone to remind you of that. No, it's like that's what I need. That's what my brain needs. So so those are a couple different ideas of things. And again, we do a lot of talking about it. She helps me a great deal. You might find this in your life, that if you're somebody who has ADHD, you might notice that you are partnered with somebody who's pretty detail oriented and somebody who has their stuff together. My wife, she has her stuff together. She's got a little bit type A. She knows, she's got the details. She knows probably more of my family's names than I do. That's just telling the truth. That's kind of how that's just how her brain works. It can remember those kinds of things, and so we're a good match in that way.
You
So,
validate my experience too.
what's that?
You validate my experience.
Yeah. Oh, yeah. That's another good one. Yeah, that's a good one. Is that I try to validate my wife's experience as well. So I try to help her. Like, I get it. I'm sorry. I know it's hard. Kind of dealing with my brain and dealing with me. And I get it. I get it. How that could be so frustrating. You just asked me to do something and I didn't do it. She asked me like, hey, can you text me those pictures? We took some nice 4th of July pictures. Can you text those to me? Yeah, sure, no problem. I don't do it. 10 minutes later, hey, can you send those pictures? Yeah. Oh, yeah. Don't do it. 30 minutes later, it's like I had to figure that. But I'm like, sorry. I know. I apologize. I was too involved in whatever it was I was doing just now and all that. So anyways, any tips for finding that? Oh yeah. Hey, Clo Nut. Any tips for finding a doctor? Yeah. So last thing I'll end on here before I get off offline here. We'll do some more of these live videos. I'm really glad that you guys are appreciating this discussion and liking my to least make a YouTube channel. I was thinking about that. I should finish my sentence first. Oh, I made a video just recently, just a second ago, about how to find how to get diagnosed with ADHD if that's what you're looking for. You know, how to find a psychological evaluation. Psychology Today is going to be a good thing to check out. Please make a YouTube channel. Okay, you guys think I should do that? I was trying to think of like how can I figure out how to make this go further, you know, like I really want to I need to especially since I have one video that is like really doing well, and that's probably where you all are kind of finding me from, that one video with the ICNU stuff, and it's really doing well, and now I have to capitalize on this experience, and so I want to hold on to you guys, you know, I don't want to lose you guys, and so maybe yeah, good Coconut, yeah, check out Psychology Today, absolutely, and you find a therapist or a psychologist in your area, but I want to capitalize on this experience so that I can figure out, you love a YouTube channel? Oh, sweet, okay, awesome. Channel on mindfulness would be amazing. Yeah, doing some more of these things. You were on my For You page with this live. Sweet, awesome, that's cool, teacher. Yeah, I was like, should I make like a Twitter for this, or like an Instagram, or like a YouTube? But it sounds like maybe a YouTube would probably be a good. We're definitely interested in YouTube channel. Okay, awesome. Maybe I'll just kind of toss one up so you guys can kind of subscribe on there. So at least I don't lose you. You know, maybe look for if we're just I think like, unless one of you guys steals it from me like just now, but look for the same name like Dr. Brian FTW, look for that maybe, or maybe I'll post it on here, so it'd be awesome to see you guys a little bit more, because I really enjoy this. It keeps my brain sharp, and I feel like I'm helping. Okay, I gotta get going. I hope everyone has a wonderful 4th of July. Happy Independence Day. If you're lighting off fireworks, hope you're gonna stay safe. If you're hanging out with people and stuff like that, please stay safe. And I'm sweating, so I'm gonna get inside in the air conditioning for a little bit. See you later, everybody. Peace out. I gotta figure out how to end this. I'll just kind of keep it on all day. Should I just keep it on all day? Like a GoPro, like attached to my head? Okay, I have to stop. I have to end it. Okay. See.